Hello, and as a prequel to this video, please watch our previous video on gastric theoretic. Basically, there are 5 indications of Nissen Fundoplication in today's world. So the primary indication of anti-reflux surgery for a GERD indication will be patient is having well-documented reflux events, preceding symptoms and another indication can be when patient is offered the choice of lifelong reflux surgery. And remember, my friends, if patient is and on the contrary, this is a repetition of my talk that patient is having severe. All of us understand that a single most important factor in development of the progression of the GERD requires early recognition of the sign and symptom of the progressive disease. Basically, there are two fundamental determinants of the GERD. First is status of the common denominator of the GERD will be disappearance of the force that mentally and exclusive access to the premium link.